Hello and welcome to our training on Social Security disability benefits presented by Disability Network Southwest Michigan. Disability Network Southwest Michigan is part of a network of 15 centers for independent living in the state of Michigan and one of approximately 400 nationwide. If you're in the state of Michigan, you can find your local Center for Independent Living by going to the Michigan Statewide Independent Living Council website, which is misilc.org, and then clicking the resources tab. Or if you're outside of Michigan, you can usually find your local Center for Independent Living by Googling your state and county name along with the words Centers for Independent Living. Generally speaking, Centers for Independent Living provide supports and services to individuals with disabilities, or we can provide connections or referrals to other organizations.
Hi, this is Pete Mulder. I've been with Disability Network for about 30 years, and for the past 20 years, I've been providing Social Security benefits planning along with my coworker, Allison Lease, and our work activity that we predominantly focus on is to provide benefits counseling for those individuals that are receiving Social Security benefits, perhaps state benefits, and helping them to understand how does employment impact the benefits that a person may be receiving.
This training is brought to you by Disability Network Southwest Michigan's Paving the Way to Self-Determination program. Paving the Way to Self-Determination is a program for families of children with disabilities, which is looking to help provide resources and training to allow children to live a more independent and self-determined life. And Paving the Way to Self-Determination is a collaboration with multiple organizations, and that includes Michigan Developmental Disabilities Council, the ARC Michigan, Michigan Alliance for Families, and Charting the Life course. And this presentation, as well as the whole program, is made possible through funding from the Michigan Developmental Disabilities Council. So before we start today's presentation, we like to just start off with what is disability, just so we have a common understanding of what the word means. And so the Americans with Disabilities Act, or ADA, refers to disability as a physical or mental impairment that limits one or more major life activities. So that could be something like moving around, being able to see or communicate, concentrate, making decisions, those types of things. And then a developmental disability, more specifically, is a disability that starts before a person reaches the age 22. So it could be something a child's born with or develops later on, just as long as that starts before age 22. If you look at the photo in this slide, you'll see a group of young adults a couple years back here who were interning at Disability Network. We use this photo just as reference because you can't tell by looking at most of these young adults that they are people with disabilities. And this is an illustration of how disabilities are sometimes visible and apparent, but often they are what we call non-apparent or non-visible. So as we go through this presentation, we'd just like to start out by saying there's a lot of really complex and detail-packed information in here, so know that we're available if you have questions after watching this presentation. This is really just intended to give a very basic understanding of some of the important aspects of Social Security benefits.
The next slide, we're going to just briefly review what are the primary topics that we are going to cover today. The two primary Social Security disability programs is one thing we're going to be reviewing. We're going to be reviewing what about youth and the program called SSI, and we'll describe that more in detail a little further in the slides. The application process for applying for benefits. What about employment? Will employment impact benefits, or will the person be able to retain their Social Security benefits, or the health care coverage that comes along with it. We'll give a description of what are resources that are counted by SSI, and also be a brief discussion regarding ABLE accounts and how an individual will be able to have more resources and keep their benefits. And then we're going to be reviewing some questions and have discussion if needed. So what is the Social Security Administration? Who are they? What is that agency? It's a federal government entity. And just a really brief review, the Social Security Administration initially was created way back in the 1930s. And at that period of time, it was really created for individuals who were elderly, not for persons with a disability. The disability portion of Social Security Administration was not developed until the later part of the 1950s. The Social Security Administration administers monthly payments to approximately 64 million people in the U.S., and of those individuals, many are retirees, and there are also individuals who are receiving a disability benefit based on either on their own work record, on a survivor's record, on a parent's record. So they administer various different programs. The Social Security Administration also provides Social Security numbers, often when we're a child. Perhaps after we're born, we're going to get a Social Security number, and it's a way to track our individual employment earnings over the years. Plus, it's going to give the retirement benefits, but also for administer program benefits for the disabled.
So this slide is starting to look at what are the two Social Security disability benefit programs. At the top of the chart here, we have the name of each program, the first one being Social Security Disability Insurance, and we refer to that as SSDI for short. The other program is called the Supplemental Security Income, or SSI program. And the similarities between the two is that both programs make a monthly cash payment to individuals who qualify for either one of the programs or both. And in order to qualify, the commonality between these two programs is that you must meet some pretty strict and specific medical or disability related criteria. That could be a mental or physical disability or otherwise. The other aspect, though, is that that disability or medical condition has to last for a year or longer, or be expected to result in death. So if someone has an accident such as a broken leg or something that is going to heal up and not last over a year, these programs would not be appropriate to apply for in that situation. Toward the bottom of the slide, we have a couple of images here that sort of reference the relationship between the application process and the other two groups that are involved here. So the first image is just an application that is being submitted to the Social Security Administration for just a basic eligibility screen. And if the application passes that screen, the application is then sent to an entity called Disability Determination Services, or DDS. This group, you can sort of think of them as like the doctor's office. They're reviewing the applicant's medical details and determining if they meet those strict guidelines that one needs to meet in order to qualify for benefits. If DDS determines that they meet those criteria, then the file is sent back to the Social Security Administration, who you can sort of think of as a bank. They are the entity that's administering the monthly payments going forward once a person is approved.
So our next slide, we're going to be talking about specifically the Social Security Disability Insurance Program. And we have to think of this benefit as a benefit that is an earned benefit, meaning it's connected to a person's work record, could be connected to a parent's work record, could be connected to a former spouse's work record. But it's an earned benefit, and it's related to the fact that the person has paid the FICA taxes, the Federal Insurance Contribution Act taxes, that are paid either by the person themselves or by the employer, or in many cases by both the individual and the employment. And it's typically 85% goes to the retirement trust fund, and about 15% is going to the disability trust fund. In some cases, the work history can be that of a parent or a spouse that I mentioned. An average benefit for Social Security disability in 2024 this year is about $1,537. Benefits can be less or can be much greater depending on what a person's work record has been or that of a parent. The health care coverage that comes along with SSDI, in the case of most individuals, once the person has received 24 months of SSDI payments, Medicare will come along. There's only an exception for two groups where Medicare can start earlier, and those are for individuals diagnosed with Lou Gehrig's disease or end-stage renal failure. Eligibility is not impacted by how many assets or other income a person might have. A spouse's income is not going to affect eligibility. Assets can be unlimited. So now I'm just going to review the next slide, which is specifically the SSDI benefit connected to a parent. So this is really an important individual. Allison is going to speak about SSI in the next slides. There are individuals, young adults, who may qualify for SSI for multiple years, but then in the future, they may be connected or eligible to SSDI connected to a parent. So how does one receive a benefit connected to a parent? The benefit is known as a disabled adult childhood benefit. Sometimes childhood disability benefits, it goes by two different names depending on who you're speaking to. And that includes Social Security. The individual has to be older than age 18 to receive a benefit connected to that parent, and be, generally speaking, unmarried, must have a qualifying disability that began before age 22. So if somebody became disabled at 35, that does not necessarily mean that the person is ever going to get a benefit connected to a parent. And the parent's the parent with sufficient work record either has retired, getting Social Security retirement benefits, have been approved for Social Security disability themselves, or has passed away, is what determines whether a benefit is going to be received.
So just to add a little clarity, because the older than 18 and before age 22 can get a little confusing. An individual, say for example, who has a parent that is starting to collect retirement benefits, yet the young person is still only 17 years old, he's not going to be eligible yet for a benefit connected to the parent because they're not yet 18. So maybe once he reaches 18 years old, he can apply for the benefit connected to the parent and allow DDS and Social Security to see if his disability would allow him to be eligible for a DEC or CDB benefit. Another example would be an adult individual retires at 65 and their son, his son, who is unmarried, has a disability, yet that disability didn't occur until age 25. So even though his disability may be significant enough to be approved for benefits, he doesn't meet that eligibility of the disability starting before age 22. Though in that situation, there could be some other benefit programs that the individual could be eligible for. This slide is covering the SSI program, or Supplemental Security Income. And this program is available to individuals who maybe do not have that significant work record, yet the individual has to have a significant financial need. So through this program, the funds are funded by general tax dollars and not connected to the FICA taxes that Pete mentioned previously. So when I mention the financial need, a person has to have limited income and assets under $2,000. That's the specific asset limit for a single individual. The SSI program exists to just assist people with the most basic needs of food and shelter. And for 2024, the maximum amount a person could receive per month is $943. Yet, if they have employment from, they have income from employment, or they have income from friends or family, or some other source of money coming in, that SSI would very likely go down. So really the dollar amount received per month depends on the financial situation. And then lastly, Pete mentioned that Medicare is associated with the SSDI program. And for the SSI program, Medicaid health coverage is what comes into play. For many states, if a person has SSI, that Medicaid is automatic, and that does include the state of Michigan. This slide, we'd like to explain a little bit about that transition from childhood to adulthood. And the information on this slide is really centered around the idea that, or the dynamic, that most children receiving a benefit because they themselves are disabled will be under the SSI program. So we're not in this slide referring to children who are receiving benefits because maybe a parent has passed away or a parent has a disability, but the child themselves has a disability. So when we consider children who have not yet turned 18, DDS and Social Security are really looking at, does the child meet the physical, mental, and cognitive developmental milestones that would be expected for their age? So really just looking at the child's actual development. And then at that point, the financial aspect would be not just considering how much the young person has maybe in income, but actually considering what are the parent or parents' income, since the parents would be considered financially responsible for the child. So Social Security would look at both the parent's income as well as assets when they're determining if that child truly has a financial need. And as referenced on this slide, the Social Security Administration refers to that process as deeming. Now when we consider an individual reaching age 18 or actually turning age 18, the medical criteria is a little bit different than when an individual is a child. At this point, we're not looking at developmental milestones, but actually, does the young person's physical, mental, or cognitive abilities prevent them from being able to work and hold substantial employment? And at that time, since the parents are no longer considered obligated to provide financially for the young person, it's only the young adult's income and assets that will be considered when determining if there's a financial need. So the reason that we like to go over this is because when the young person is approaching age 18, Social Security is going to conduct what's called an age 18 redetermination. They're looking to see if the disability that the young person has, or multiple disabilities, will meet the eligibility criteria that exist for adults. Does this young person's situation warrant continued payments based on their disability? The reason that we like to point this out and the important considerations related to the age 18 redetermination would be, it's important to understand that a student who has been denied SSI as a child could actually be approved once they reach age 18 because the parent's income or assets are no longer considered part of the financial situation. It's also possible that a young person who was approved for benefits could be denied once they turn 18 based on the different criteria. And Pete, correct me if I'm wrong, isn't that the case that it's often harder to be approved under the adult criteria in comparison to the child criteria?
Yeah, the key thing to remember when reaching age 18 and being older than age 18, the criteria is a little bit more strict, and predominantly it's all related to the fact of looking at employability as an adult. Can that individual be employed? And also, can that individual not only be employed, but also substantially employed? Again, for the minor under the age of 18, employment is not really looked at. So it definitely is a stronger criteria for those above the age 18.
So important takeaways from all of that information is that it's really important to focus on employment skills training, opportunities like work-based learning, building skills for independence, volunteering, all those types of things. Even if a student has benefits and it's expected that those benefits will continue past age 18. Taking the opportunity when children are young to build up those skills as much as possible is going to benefit them. Before we go to the next slide, we do want to mention that you have a couple different options of applying for benefits. Generally speaking, you can apply online or by phone. Just note that you definitely don't want to start an application unless you're sure that you are on Social Security's website, ssa.gov, since there are other sites that will try to steal your information or claim that they will assist you, and not necessary to use those sites. All right, so on this slide, we are just reviewing the application process logistics for a minor. And one way that an individual can start the process for applying for benefits is online. Through this process, a person would be providing their medical information in what's called the Childhood Disability Report. And it's actually often recommended to create an online account at ssa.gov. And there's quite a few things that this account can do aside from just assisting with or allowing for the application to be started. You can avoid going into a local office in person or contacting Social Security by phone to do things like get a replacement Social Security card or update an address, those types of things. Anyhow, starting the application process online, again, just providing medical information. And once that's completed and submitted to Social Security, Social Security will reach out to the applicant or the guardian and schedule a phone interview. And that can be a semi-lengthy phone conversation, but that will occur with a Social Security claims representative. An individual can more or less expect to receive that scheduling phone call in about 5 business days. That, of course, could be a little bit longer depending on holidays or even just the local office capacity, but typically about 5 business days to schedule that phone interview. And looking at the Childhood Disability Starter Kit can be super helpful to prepare for that phone interview. The starter kit is going to go over kind of what can be expected and what types of questions or topics will be brought up in that interview. Alternately, there's also the option to start the process by phone, just calling the local office, letting them know that you want to apply for benefits, and at that same time, the full interview process will be scheduled for a later date. Regardless of how the application process is started, it's important to understand that whether it's starting online or by phone, that day that the application is initiated is locking in what's called the protected filing date. And that means that once the application process is completed, even though the approval might take several months or even longer, Social Security, if the individual is approved, is going to look back at that potential entitlement date of the date that the application was started online or by phone. And that means that ultimately when benefits start, a person will be paid back to that first month as if the application had been approved at that time. In comparison to applying for benefits for a minor, this slide, goes over the logistics for applying for an adult. So options again include starting the process online. You'd be providing medical information, and then at a later date, completing a phone call with Social Security for the rest of that process. Be aware that if you have previously applied online for SSI, then you would not be able to apply again online. You would just need to start the process a second time or additional time by calling. That's specific to the SSI program. For the SSDI program, an individual can submit their full application online and avoid that phone call entirely. If wanting to avoid online to get the process started, you can go ahead and make a phone call again to the local office. And same situation for both SSI and SSDI as for a minor. You're again just calling to express that you want to apply for benefits, and you'll be scheduling a time to do the rest of that at a later date. So this slide just goes over some logistical things, some tips to keep in mind as you're looking to apply for benefits. So first and foremost, there's some great resources on SSA.gov, including the childhood and adult starter kits. These give information about what to expect. They give some guidance on what information you should have prepared to share. Just a lot of general information that can give you a heads up on what to expect. So the next thing is that if you are an individual who is able to start the application process online versus entirely on the phone, Pete and I have been given some guidance by actually very knowledgeable Social Security staff who suggested that an individual can kind of create a better application product by putting in their own information as opposed to sharing that information over the phone with Social Security, who's then trying to put it into the computer for you. They're of course going to do their best effort to capture what you say, but an individual doing that for themselves might create a better product. We are also advised to share that an individual should be kind of on the lookout for any unexpected calls within the next handful of days. So depending on the cell phone carrier a person has, that call from Social Security might show up as spam. It could show up as Social Security. It could also show up as unknown. So just any calls that are coming within the next few days, it's a good idea to answer them as opposed to having to listen to a voicemail and call back and wait and try to track that caller down. It's also helpful to just keep in mind that unfortunately the application process can take a while. So just, don't expect for this to be an overnight or even just a couple weeks process. It really can take anywhere from several months up to a year just for that first application process to be completed. And then this is a pretty simple suggestion, but setting aside quiet time for that phone call to just allow to provide full attention. Not trying to do that while cooking dinner or running kids around or anything, just because it will be, they'll be asking some complex questions that will really be answered most completely if you can give your full attention. And then toward the bottom of the screen, there's some other information that can be found on the application process at ssa.gov/benefits/disability.
The next slide, we're reviewing just a brief overview of if I'm receiving SSI, if I'm receiving Social Security disability, and I do want to share, there are individuals who, not as a child, but as an adult over the age of 18, there are individuals who receive both SSI and SSDI. We're not going to try to explain how all of that works at this time, but the big question becomes, can my child, whether a minor or as an adult, can they work? And the answer is, of course, yes. And benefits counseling and work incentive planning helps explain how working can lead to better financial outcomes than just receiving benefits alone. One thing that I'll just simply state in general, individuals receiving SSI who do return to whether it's part-time or full-time employment, definitely the amount of benefits that that person will have going into the future is going to be more than just trying to live off of SSI or SSDI for that fact. And so we have a couple examples on the screen here. We've got Sally. She's a high school student receiving $943 from SSI. She returns to work or goes to work part-time, earning about $400. Her SSI is not expected to be impacted in most cases as a student. Just for the example of Sally, we're going to have Sally as being 18 years old, getting SSI only, and she's still within the school system. But if she returned to work part-time during the school or during the summer months, SSA, Social Security Administration, has a work incentive called a Student Earned Income Exclusion, and thereby Social Security can exclude the work earnings if she is still a student under the age of 22. The secondary example, Sally has graduated completely out of the school system, and she's receiving the $943 per month in SSI. She has part-time work earnings of $400. At that point, her SSI will slightly be reduced, where Social Security would actually be counting a little bit less than half of her work earnings, and thereby using the example of 400. In that situation, Social Security would count just approximately 150 of her work earnings, and thereby reducing the SSI check by about 150, but certainly not canceling the SSI benefit. And earlier we stated if a person is getting SSI and they were receiving also for healthcare coverage, Medicaid, going to work part-time is not going to impact the Medicaid eligibility either. And that's where, in the bigger picture, receiving benefits services, benefits planning services for your young adults, whether in high school or beyond high school, and understanding there are a lot of different work incentives that help the individual retain their benefits when going to work.
On this slide, we will be talking about ABLE accounts. ABLE stands for Achieving a Better Life Experience. And the goal of these accounts is basically to allow people who have benefits from means-tested programs like SSI or even Medicaid, food assistance, and the list goes on. But anyone who has those types of programs in place allowing them to save to prepare for their future, cover just different costs that they have in their day-to-day life without jeopardizing those means tested benefits. And so we call ABLE accounts asset shelters. And that means that any money that a person puts into an ABLE account is sheltered from accountable assets. So it doesn't count as far as how much a person has in assets that would be included for SSI, Medicaid, food assistance eligibility. So at this time, a person could be eligible for an ABLE account if their disability began before age 26. Also, if they receive SSI or SSDI. Yet, if a person maybe could be eligible for SSI or SSDI, but they don't have that benefit in place yet, if they're able to get a diagnosis from a physician, then they'd be eligible for an ABLE account as well. As I said, right now the age limit is 26. Yeah, in a couple years here, the age limit will be increasing to 46. ABLE account funds must be used on what are called qualified disability expenses. So they can't be used necessarily on just anything a person wants. But things that would fall under qualified disability expenses, there's just a huge amount of things, whether we're talking housing, healthcare, education, employment training, assistive devices. I mean, just the list really goes on. It's usually easier to identify what doesn't qualify as a qualified disability expense. A couple examples might be alcohol, jewelry, gambling, some things of that nature. Contributions that are made to an ABLE account can be by the individual with the disability, who's the account owner, or contributions could be made by friends or family or others, and those contributions are actually tax deductible, that are the contributions made by friends or family. Technically, there is some a situation called a Medicaid clawback, where if an individual passes away, the state of Michigan could seize any remaining funds that are in an ABLE account to repay the state for Medicaid dollars that were spent on an individual. Another training that's a part of the Paving the Way to Self-Determination series was provided by Scott DeVerona with the state of Michigan, who is the lead individual for ABLE accounts here in Michigan, and he had shared with us that yes, technically the state could do that, but the state has never done that at this time and doesn't plan to do that because they really want to encourage individuals to be able to save for expenses like a vehicle or security deposit or other things of that nature.
So our next slide, we're just going to bring up 5 questions that are very common for questions that are posed to either Allison or myself when we're doing benefits planning. And the very first question just says, what disabilities or diagnoses will allow someone to be found eligible for disability benefits? Having certain diagnoses generally will not automatically qualify for a benefit from either SSI or SSDI. The conditions must meet certain severity. One thing to note about this question also is certainly Social Security over the years has come about to saying certain diagnoses that could be terminal or severe can be approved more quickly than other disabling conditions. So it's a very complex question in many ways. And again, it ultimately becomes the Disability Determination Service, that state agency that does and looks at all of the various conditions to determine the eligibility.
I would add to that too, Pete, to say, for example, I've been asked many times by a parent, my child has an autism diagnosis. Will that get them approved for benefits? And as Pete has mentioned, that it really doesn't depend just on that label. It's what are the dynamics for that individual, and how does their disability impact them. So the next question we are often asked is if an individual should hire an attorney or get some other legal representation involved when they're starting to apply for benefits. What we typically share is that most attorneys don't really want to be involved in the application process. They really are interested in becoming involved in supporting a person once they've received a denial notice, and want to, say, appeal that denial. So by all means, you could contact someone, but they likely would say, follow up with me down the road if you aren't approved for benefits, and then we can help you.
So our third question is, for minors who are found ineligible for SSI benefits because of parental resources, so parental assets, the minor is under the age of 18, when should they plan to apply for SSI when they're reaching the age 18? Remember, after age 18, the parental assets income is not part of the picture, and a person can prepare for this application process by collecting documentation, all the information, and again, we've mentioned that there is the SSI starter kit for an individual for SSI, and there is a starter kit for those that are applying for SSDI, but ultimately for SSI for the minor, the benefit is not going to be there until age 18, so technically you apply when the person reaches age 18 to begin the process. And if it's going to take a half a year or more to get approved, the benefit would be retroactively paid back to the date when the person reached age 18.
The next question is, how will Social Security determine parental income and assets for a minor when the family dynamic is that parents are separated, they share custody, or maybe the parents are divorced? And this is a tricky one. Parental deeming it's a super complex process, and ultimately, Pete and I can maybe share a little information on it, but ultimately it's up to Social Security to complete a process or a review of the dynamics and determine how much of each parent's income would be considered available to that specific child. Other factors might be how many other children are in the home, how many of those children have disabilities themselves. So it gets pretty complex pretty quickly. That said, unless custody is truly 50-50 between two parents, only the income of the parent where the child is living most of the time is going to be considered. The other aspect is that Social Security is only going to deem income from the biological parent and potentially step parents within the household. So typically, deeming will not occur from parents outside the household. And then lastly, we often are asked about, just kind of connected to that same question, if an individual's parent is paying child support, is that going to potentially impact the SSI payment that child is receiving? And the answer is yes. Even though child support payments are provided to the other parent, that's considered income for that minor child and would result in the SSI payment going down.
Just in a quick summary, as Allison was indicating, any and all income, any and all assets can be looked at for the SSI program, whereas with the SSDI benefit, the rules are drastically different. And for SSDI, parental assets, parental income, spousal income, none of those things are really viewed when looking at the SSDI program.
On this slide, we have quite a few resources that absolutely could be looked over if wanting to learn more about what to expect, if wanting to For example, see information in an alternate language. So Spanish in particular is offered right through the Social Security Administration's website. This page, we could go through each resource, yet the one that we probably feel is the most important on this slide is the second bullet, which is disability secrets.
And I'm just going to share a little bit about Disability Secrets. We're not endorsing the website. It's really created by attorneys. It's always kept very up to date, and you could literally spend hours on the website looking at it, anything from how to successfully apply for benefits, and that is even one that it can be specific to what a person's disability is. So you could spend a lot of time on this website, but it's got a lot of excellent tips, lots of information on there that are helpful when applying for benefits.
This next slide is additional resources, not necessarily related to applying, but just general related to disability benefits. And again, we won't go through every resource listed, but as Pete mentioned earlier in the presentation, we just want to point out the option to create an account through Social Security. So those accounts are called My Social Security accounts. And as he alluded, there's lots you can do. You can replace a Social Security card, check an application status, get proof of benefits, all kinds of things. So just a good resource that's free and secure and good to be aware of.
It's also worth mentioning the second bullet down on this page. There are disability network centers for independent living. That's the key. There are CILs throughout the state, and there's a link there. Many other centers for independent living, disability networks, do have benefits planners on their staff. Maybe not all, but many of them do.
And lastly, we would like to reference our partners. Again, Pete just mentioned that there are other centers for independent living across the state. Specific for Paving the Way to Self-Determination, this series, we want to thank our partners, Michigan Developmental Disabilities Council, Michigan Alliance for Families, the ARC, and Charting the Life course. And then, of course, additional information about each of those groups is available on this slide.
And lastly, just again, Allison and myself, we're glad to do this presentation for you, but we also want you to realize if you do have questions and you do need to reach out to us, we have our contact information listed on this page.
Thanks for viewing the presentation, and let us know if you have any questions.